Could President Trump's new pick to lead the CDC signal a shift in how the administration tackles public health? Hi, everybody. I'm Ruben Jones. President Trump nominated Dr. Erica Schwartz last week to run the Centers for Disease Control and Prevention. She is a former Deputy Surgeon General. She once led the Coast Guard's network of 41 clinics. So she comes from a more traditional medical background. That was a surprise from many because when you look at who President Trump has put forward for medical positions in his administration, they're noticeably different. Take, for example, of course, Department of Health and Human Services Secretary Robert F. Kennedy Jr. And so her nomination was greeted warmly by many in the more traditional medical background.
Dr. Schwartz is a really good pick.
They've got someone who I think is well-trained, experienced, knows the department.
Schwartz has a long record of guiding vaccination programs for the government, and her nomination was not greeted warmly by some in the Make America Healthy Again movement, including attorney Aaron Siri, who has worked with Kennedy. He posted on X saying it is incredibly ironic that Donald Trump would write that his pick to lead the CDC will restore the gold standard science at the CDC when his pick is the queen of mandating vaccines. So Schwartz's pick could signal a shift by the White House when it comes to public health, perhaps distancing itself some from the MAHA agenda. And it could potentially signal Kennedy's influence is waning as well.
It certainly is a shift in making sure that they put in place a competent team. I think we should wait to see whether or not it's really a shift in what they're going to let them do.
There's significant skepticism about how independent Schwartz can be if she is confirmed to run the CDC. Keep in mind, Dr. Susan Menarez, who was a longtime public health official, only lasted on the job less than a month before getting ousted over a clash with Secretary Kennedy on vaccine policies. So it'll be wait to be seen how the administration, if the administration is changing its approach on public health and what role Secretary Kennedy has on this going forward.